Hello and welcome. Today we're diving deep into a complex and serious condition known as hepatic encephalopathy. It's a brain dysfunction caused by liver damage and can significantly impact a person's quality of life. We'll explore its causes, how it affects the body, the signs to watch out for, and the available treatment options. So, let's get started. Hepatic encephalopathy, at its core, stems from a liver that isn't functioning properly. The most common culprits are chronic liver diseases like cirrhosis, often resulting from long-term alcohol abuse, or chronic hepatitis B or C infection. Other less frequent causes include acute liver failure, conditions like Wilson's disease which causes copper accumulation in the liver, and even complications following certain types of liver surgery. Essentially, anything that severely impairs the liver's ability to filter toxins can lead to this condition. Now let's break down the pathophysiology. The liver normally filters toxins from the blood, including ammonia, a byproduct of protein metabolism. When the liver fails, ammonia and other harmful substances bypass the liver and accumulate in the bloodstream. These toxins then travel to the brain, interfering with normal brain function. One of the main mechanisms involves ammonia crossing the blood-brain barrier and affecting neurotransmitter systems, causing an imbalance that disrupts brain activity and ultimately leads to the neurological symptoms we see in hepatic encephalopathy. When it comes to epidemiology, it's closely tied to the prevalence of chronic liver disease. Hepatic encephalopathy affects a significant portion of individuals with cirrhosis. Studies suggest that approximately 30 to 40% of people with cirrhosis will experience at least one episode of overt hepatic encephalopathy during their lifetime. The incidence rises as the severity of liver disease progresses. It's a major cause of hospitalization and healthcare costs associated with liver disease. The signs and symptoms of hepatic encephalopathy can vary widely in severity, ranging from subtle cognitive changes to a complete loss of consciousness. Early symptoms may include mild confusion, forgetfulness, changes in sleep patterns, irritability, and difficulty concentrating. As the condition progresses, more pronounced symptoms can emerge, such as disorientation, personality changes, slurred speech, and a flapping tremor of the hands called asterixis. In severe cases, the individual may experience seizures, become unresponsive, and eventually lapse into a coma. Diagnosing hepatic encephalopathy involves a combination of clinical assessment and diagnostic testing. Doctors will consider the patient's medical history, particularly any history of liver disease. A physical examination will look for signs like asterixis and other neurological abnormalities. Blood tests are crucial to assess liver function and measure ammonia levels. Elevated ammonia levels can support the diagnosis, though they aren't always definitive. Neuropsychological testing can help evaluate cognitive function and detect subtle mental impairments. In some cases, imaging studies like MRI or CT scans may be performed to rule out other potential causes of neurological symptoms. Hepatic encephalopathy is often categorized based on its underlying cause and severity. One classification system distinguishes between types A, B, and C. Type A is associated with acute liver failure, type B with portosystemic bypass without intrinsic liver disease, and type C with cirrhosis. Severity is typically graded using the West Haven criteria, ranging from grade 0, which is minimal hepatic encephalopathy, to grade 4, which is coma. This grading system helps to assess the patient's condition and guide treatment decisions. The primary goal of treatment is to reduce the levels of ammonia and other toxins in the bloodstream. Lactulose, a synthetic sugar, is a commonly used medication. It works by drawing ammonia from the blood into the colon, where it is then excreted in the stool. Rifaximin, an antibiotic, may be prescribed to reduce the number of ammonia-producing bacteria in the gut. In addition to medication, dietary modifications are often recommended, including limiting protein intake in some cases and ensuring adequate calorie intake. Addressing underlying liver disease is critical, and in severe cases, liver transplantation may be considered. Prevention primarily focuses on preventing or managing the underlying liver disease. This includes limiting alcohol consumption, getting vaccinated against hepatitis B, and taking precautions to prevent hepatitis C infection. For individuals with existing liver disease, regular monitoring by a healthcare professional is crucial. This helps to detect early signs of hepatic encephalopathy and initiate prompt treatment. Adherence to prescribed medications and dietary recommendations is also essential in preventing recurrent episodes. The prognosis for hepatic encephalopathy varies depending on the severity of the underlying liver disease and the effectiveness of treatment. With prompt and appropriate management, many individuals can experience improvement in their symptoms and quality of life. However, in patients with advanced liver disease, hepatic encephalopathy can be a recurring and debilitating condition. Liver transplantation can offer a potential cure for some patients. Current research is exploring new therapies, including novel ammonia-lowering agents and strategies to improve cognitive function in individuals with hepatic encephalopathy. Scientists are also investigating the role of gut microbiota in the development of hepatic encephalopathy, opening new avenues for potential treatment approaches.